So this week I'm collecting my thoughts in terms of where we're going to go, but I am joined again by Lisa Ederson, who has been on the podcast before. And Lisa is a doctoral researcher and a psychosexual therapist. That means sex therapist. And I'm joined by one of my other esteemed colleagues in this area, Silva Neves, and he is a psychosexual and relationship therapist, again, sex therapist, which means we are already starting off with, let me go to either why do you do what you do and what brought you into the world of psychosexual therapy, and what does that actually mean? So I will probably put in the show notes something about, this is for 18 plus in terms of conversations, content that appears here. But Lisa, I'm sure I've asked you this before, and I wonder if things have changed since last time. So why do you do what you do, and what brought you into psychosexual therapy work?
What brought me into the work, which was over a decade now, was I was working in needle exchanges. Well, I was working in needle exchanges, and then I set up a business doing training and what have you. But when I was working clinically, because my background is also as a nurse, when I was working clinically in needle exchanges, I was working with Class A drug users, so predominantly heroin users, crack users. And when you're in a needle exchange, you really don't know who's coming through the door, and you don't know what you're going to be presented with. And you're presented with people who are taking real, quite serious risks with their health, including sex. So the conversations I was having with people were generally not the kind of conversations that you would have with kind of anyone else. They were quite difficult conversations. They were very personal conversations. I was doing all of the HIV, ABV testing, which means Hep C, Hep B, so as well as HIV. So, you really had to ask them questions that people would generally shy away from. And I just realized that I was really quite good at having these types of conversations. And I think it's a particular skill, really, I suppose, to not be fazed by anything that you're going to come up against. So when I was looking to do something new, sex therapy for me just seemed like a really, really obvious choice, because it was just those real transferable skills to be able to go and have these really intimate conversations with people, whilst being really respectful about the choices that they were making, the things that they were doing, and coming at it really from that pretty much harm reduction approach as well. So being in harm reduction just taught me so much about how to be with other people's behaviours, I suppose, that maybe not I would necessarily engage in myself, but to not bring in that judgment. It's very, very judgment free being in that world, because it has to be. So I think that put me in really good stead. So that's kind of how it started. And so what was the other question? How has it changed?
Well, I'm just wondering if anything has changed in terms of why you do what you do. Now, where my head has already gone is that's possibly what's led you to your doctoral research around shame containment theory, which we will come back to at some point. But what has changed since we last spoke on the podcast? And bearing in mind that's going to be really difficult because we speak regularly. So why do you do what you do? Let's just go with that.
Why do I do what I do? Because somebody needs to be having these conversations.
Yeah.
Somebody absolutely needs to be having these conversations where we can reduce people's shame. And what I see more and more, especially when it comes to social media, and I don't know how much things have changed, perhaps from 2017, maybe not all of that much, is actually how much shaming goes on in social media. So when I see clients come into the therapy room, they're already full of shame because of all of this information that they've been given. And I think this is one of the things that connects the three of us all together, isn't it? Is that we're quite frustrated really about some of the things that we see on social media. So a big majority of my job is debunking myths. And stuff that isn't factual and, not scientific, and all of the stuff that we talk about quite regularly.
Yeah.
And it needs to happen more and more. And I think that the difficulty, I suppose, with being you mentioned the word sexologist before, but Silva and I being psychosexual therapists, is that there's not really that many of us around.
Not in comparison to
a lot more aware about, in comparison to
normal.
I don't want to say standard therapists, that sounds really derogatory, doesn't it? That's not really what it means. The people without this specialism. who actually can have those conversations to debunk the myths. And just the more time has gone on, the more passionate I've become about actually being able to do that, which is where the shame thing comes in as well. You know, I was just saying so much shame and
Yeah,
very little written about shame, really, that I needed to kind of focus in that area.
yeah. And I'm sure we'll come to that, because that's pretty much my first question to you both after we finish this part. So Silva, who is also an author, let me just say that actually, you are a multiple author of many books and chapters and bits and pieces. So, you know, why do you do what you do, and what brought you into this world?
Well, a long time ago, actually, I identify as a gay man. And I remember the very first time I started to have some feelings about being gay was way before puberty. I remember in primary school when I was 5 years old and I had a crush on another boy my age. But of course, at the
Hmm.
time, I didn't realize at the time it was, I was too young. It wasn't like a sexual feeling or a romantic feeling, but it was a feeling that I already knew was wrong. I was already socialized to understand that whatever I was feeling
Yeah.
about that other boy was wrong. So for me, from 5 years old, really, a long time ago, sex and sexuality and sexual identity and sexual expression has always been a part of my concern and a part of my thinking, because I've been having those feelings for such a long time. And when
Hmm.
I finished my core training in psychotherapy, I was really frustrated and disappointed that in the whole 3 or 4 years of my core training in psychotherapy, there
Hmm.
was nothing on sex or sexuality diversity. And
Yeah.
so then I had to do a specialist course, because I really, really wanted to work with people and their sex lives. And I had to do a specialist course. So I did the psychosexual and relationship specialist course, which is another 2 years of training, to then be able to be a sex therapist and a relationship therapist. And to the point of Lisa, I think it's a real shame that generic therapists are not trained to talk about sex. I really believe that
Hmm.
all psychotherapists should be trained to learn to talk about sex, but they're not. So that's what really led me to the field, is
Yeah.
with that. Really, it's that, my supervisor says that my clinical training started 15 years ago, but my actual training starting when I was 5, when I really was
Yeah.
aware of sexuality.
Right. So you've already made my internal map of what we're going to talk about go all over the place all at once in so many questions. But I'm thinking, first of all, so when I did my standard training, I did a TA transactional analysis model, and we did talk about when you do an intake, especially with adults, one of the things that you might ask about is their sex lives, full stop. Okay, so there was nothing about what we would then explore with that sex lives, what we would do with people's kinks or squinks, and we'll talk about that later. But the bit that's missing for me, and I want to make it quite clear for the listeners or viewers, is sex therapists only work with 18 plus. So what's been missing from my perspective is that era that I worked with as a relationship sex education teacher, and certainly as a child and adolescent psychotherapist. There is hardly anything, if not now, a specific area that we might get to in terms of the topic. But that idea of shame, we would work with people's shame in terms of what presents in a child, but we would never ask about the shame, or we would never be taught around this particular area. And sadly, I'm going to make this a statement: sex does not begin at 18. Okay, so there's something
Exactly.
about, we have a huge deficit of knowledge and literature and approaches, and we are doing a disservice to people who cannot access psychosexual therapists, of course, until they get to 18. Maybe, and I'm just thinking, some membership bodies might allow people in at 16, maybe, because obviously that's the age of consent. But here we are. So you can only work with 18 plus in terms of working with adults. So what is that like for either or both of you can answer in terms of jumping like popcorn. But what is this like to have already, where people come into your therapy office and they are now adults, they have already been through the trajectory of adolescence, even that primary school stuff that you're talking about there, Silva, is really, really important.
Yes, I mean, when clients come to me, I do investigate their childhood, and so try to get them to remember what it was like back then. And I don't start because of my own experience. I don't start talking about people's sex lives in puberty, or for queer people, I don't start with, how was your coming out? Because usually that will be the first question. For me, I start is, when
Yeah.
was your first crush? And that's when people start to think, oh, it was when I was in primary school. It was my teacher. It was a peer, or it was, something on TV. And so then we can start to really trace as far back as possible, not about their actual sex life, but about sense of the sense of sexuality in some ways, even though it will be different terms for a child. But it's part of the core sense of self. It's part of being human. It's part of how we get socialized. And if the feelings that we have internally is different from what we're told we should have in society or by our parents or whatever, it creates a conflict really, really
Yeah.
early on.
Yeah.
And that's when shame comes. Shame goes straight in there. And sometimes it's really, really, really from single digit age.
Absolutely. Absolutely.
Yeah, I agree. There's nothing I could add to what Silva's just said there. Obviously, I work in exactly the same way that, we're thinking about sexuality from a very, very young age, from as far back as people can remember. But I think one of the things that's really important for me is, which is why this is going to sound like a blatant plug for your book, which it kind of is. I really think that people should be reading your stuff as adult psychotherapists or adult psychosexual therapists, because if you've got somebody who's 18, who, it's quite legitimate that an 18-year-old is going to come through our door, their experiences that you write about are only a year, 3 years, 4 years previous to them actually coming to us. And I think we can learn a lot as adult therapists. We can learn a lot from child therapists too, or certainly from the perspective that you're looking at sexuality, young people, what they're looking at, what it is it that they're doing, because that's really helped me to inform my questions as well by reading your work. And it's also given me a language that I maybe wouldn't have had before.
Well, without kind of going on, thank you very much for the lovely stuff. Moving on. There's also something here, which is when we start to hear that word sexuality, and I don't know if this is my interpretation of the landscape, especially on social media at the moment, but we have massive rising cases of children being sexually exploited, sextorted, sexually coerced. And since social media came along, children's sexual development, so I don't want to call it sexuality at this stage because it would be sexual development, begins as early as they can access any kind of screen. Right now, I'm not talking social media here for those that want to go, oh, this is evidence for the ban. I'm talking about television. So even if I just make a reflection on, we need to talk about video streaming platforms, Disney, Prime, Netflix, etc., etc. I am aware of children that I've worked with that have read 50 Shades of Grey. They've watched Sex Education. They have watched the kind of film remakes of 50 Shades of Grey. They're watching films where rape scenes are taking place, etc., 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 way beyond getting towards social media. And the bit that's missing for me is I don't see any training routes for people to be able to have those conversations with, and I'm going to use the phrase children, meaning under 18 on this instance, aside from gender identity, in terms of that seems to be the logo at the top. But what I don't see is sexual development, because it's that icky, what are you talking to children about sex for? And actually, I'm doing the work with children that are being sexually exploited. They're being exposed to stuff and engaging in, rather than just having a crush, being able to talk to that crush, etc., etc. So it's going to be a why question. So why do you think we are not looking at this inherently, other than from an abuse perspective? Now, that might be too big a question in terms of, that's me social commentating, I think, really.
I think there's something, yeah, right. It's the ickiness of thinking about children being sexual, which is very different from being sexualized. So the idea that children are being sexual. So the only way that we can have that conversation legitimately, it appears, is to prevent abuse, or when the abuse has happened. Because I think there's so much discomfort in the idea that we should be talking to kids about sex.
But we talk to them about porn. This is my, and that's where I was kind of thinking that I'm thinking it's going to be really important that we get to shame in just a second. But there's a huge, do you know what? I've just had a shame experience, which I'm going to tell you about, because I've just had one where I've realised my nails need the polish redoing. So they look really naff and I know people can't see that if they're listening to this. And I just had the just keep your hands below the screen calf. There we are. That is how inherent shame is when it's an internal voice. So we could debunk that if you want, but moving on. So hang on a minute then. So where was I going with that? Right. We talk to them about don't view porn because, and then we talk about the harms that it causes, etc., etc. And obviously, Lisa, you've been on my training for this. But we are talking to children about sex is bad. That's pretty much the message that I'm seeing,
absolutely.
isn't it?
And that's why we can talk about porn, because the you know that narrative is porn is bad. So of course we can talk to children about porn, because we're telling them not to do this thing. It's like, you know, people of a certain generation are going to remember being taught about STIs and pregnancy, you know, like you're either going to get pregnant or you're going to die. So all conversations when it comes to children are about the bad stuff.
Yes, and going back to your earlier question, Kath, about, what do we, we start working with people from the age of 18, but often with people who have problems in their sex life, they would say something like, well, sex was off the table. Nobody's ever talked about sex. It's something that we should not talk about. So then we feel shame because we're interested in sex before the age of 18. And then suddenly, magically, as soon as we are legal to have sex, we're supposed to have great sex, and we're supposed to know what we're doing, and everything should be just okay. And it's not that way. And then people have developed, sexual dysfunctions.
Right. So let's just throw all the kinds of questions that I even planned out with the head. Okay, let's go with, why are we talking about sex is bad? Why are we talking about porn is bad? Shall we just debunk? I'm just thinking, actually, we've got shame here and we've got the myths, and you know what, let's throw all that out the window. Why are we talking in this way, do you think?
I think it's very, very uncomfortable for many people. Even for adults, it's really uncomfortable for some adults to talk about sex. That's it, just this, to say, intercourse, what does that mean? Penetration, what does that mean? Even something softer, like, what does monogamy means to you? Those questions that are our bread and butter as a sex therapist is really confronting for a lot of people. And so we are not socialized at all to be able to be comfortable to talk about sex, to talk about intimacy. What does that actually mean? Even to talk about love, it's all made with myths and fairy tales and so on. So those conversations, a lot of people are really, really lost in those topics. And when people are lost, when they don't know how to have this conversation, they just won't have them at all. So they'll just be quiet and ignore the problems for as long as they can.
And this is exactly why I think that, I mean, there's a lot about the sexual abuse of children via online mediums, and I think there's something here about that ickiness, that shame, that it's really, it's more than uncomfortable. It's more than uncomfortable, Silver, isn't it? I mean, just think about this podcast here. We're going to have, I mean, I'm just thinking you've just started with some words there in terms of, we have swear words, and I'll go first. We have the swear words that, somebody will go, for fuck's sake, fuck this, fuck that, right? We are comfortable using offensive language, but we're not comfortable about talking. Maybe if a child comes in and says, what does that mean? Or what, we just go, it's a swear word. There we are, full stop, end of, go away, don't ask anymore.
Yes.
So if we can't explain about bodily functions, sexual words, what they actually mean, etc., etc., there's a whole heap of things that are going to be missed, and then that just embeds the shame further and further and further.
Yes,
Maybe?
exactly. And they keeps being, so then the narrative continues, sex is bad, porn is bad, so that we don't have the conversations to make all the adults a lot more comfortable about it.
Yeah.
But we're actually leaving all the children and all the people that are wanting to access pornography, adults wanting to access pornography, or children who want to because they're curious about sex and they have zero sex education. We leave them all in the dark with no education. So therefore, that's when harm can be done.
Well, I'm just thinking, actually, there was a lot about when I was doing the sex education stuff, it was going, and it was literally the pragmatics, you know, veer away from the STIs, go for the abstinence model. We don't talk about pornography. We don't talk, and yet that's where my knowledge really started with the young people, in terms of when we were doing the exercises, they were writing things on paper, and I was like, how do you know about that? Oh, well, it's because I've been watching or I've been listening. So we often look to the porn is bad, sex is bad, but we've forgotten that conversations happen around children, you know, adults, depending on what's happening. I'm just going to put a scenario out here, that children are at a pub in the summer, and there's a couple of people who are more than tipsy, who are having a bit of a snog, you know, or they're getting a little bit touchy-feely in public. And then what we do is we say to the children, don't look. So that's what I'm thinking here in terms of, so
Yes,
before I meander off on my
prohibition and you know, shame and so on. Even last year, you know, that's a bit of a parallel conversation. But last year we were asked to do a talk in a sexual health conference to talk about sexual pleasure, and the feedback was that the topic of sexual pleasure never comes up in sexual health conversations, because it's all based on diagnosis, STIs, problems, dysfunctions, and not about actually why people have sex, which is incredible, isn't it? That is
Because
so
it's
embedded.
nice.
It's so embedded in our culture. It's so embedded in our culture that we don't talk positively about our sexual behaviors, only about the problems and the diseases.
And the moralistic, value-laden approaches.
Yes, because there's that as well, as part of, you know, the whole of that, the culture and society that is quite sex negative. We also have some people who, I will say, use their professional status to push a moral agenda, unfortunately, and confuse the public between their own opinion to facts. And often in social media out there at the moment, there's a lot of confusion between what is fact and what is people's opinions. And some clinicians who may have some religious views, and typically the religious views are that porn is very, very bad, will push that forward as a fact coming from a clinician, when in fact it's their religious beliefs.
Silva, you've just opened up an absolute wonderful segue into, okay, let's debunk the myths for a start off. Obviously, we have these conversations regularly, and it's a reaction to the shame-driven narrative on social media, which is that one that's coming from that particular perspective. And I see this in the abuse literature. I see this in particularly around the online safety spaces, in terms of what we talk about. And actually the way that I'm seeing, okay, and here we go, addiction, dopamine. Okay, where do you want to go with this?
Oh, those words, we love those words. They are thrown around
they're in.
everywhere. Dopamine. We hooked to dopamine. Porn is bad. Addiction. Oh my God, we're going to become sex offenders.
Well, there's the root. And
that's the root.
That's okay. So let's debunk this. Actually, porn viewing, because I never use the word consumption or use, right? Porn viewing, especially by young people, is not used in the same way as adults. But certainly, we're not looking at self-soothing mechanisms. We're not looking at trauma in this. And I can see you're nodding profusely there, Lisa. So maybe I will hand over to you in terms of, okay, where does this fit with shame containment theory? Where does this fit with trauma? And self-soothing? What else could we call it? It's deflection. There's so many ways that we could talk about this.
Yeah, and I think that completely sums it up. I mean, as you know, just for transparency, I don't subscribe to the idea that sex or porn use can be addictive at all. You know, there isn't the evidence, which we'll get to at some point, I'm sure, throughout this podcast, about what the evidence that actually is there. So my PhD research is in shame as a etiology, which basically means the cause.
Yep.
For compulsive sexual behavior. And the only reason why I use the term compulsive sexual behavior is because that's the only one that is a legitimate term at the moment, because it's there for the World Health Organization. Still don't necessarily agree with that one either, but it's the only one that we've got. So that's what my PhD is. And what I'm looking at is is it possible that people are using sex and porn in a particular way that actually helps them to manage what I now call attachment injuries?
Yes.
And attachment injuries, so what I mean by an attachment injury is the disconnect between child and caregiver that makes us feel, as children, as very, very young children, makes us feel unsafe. Just for, the very quick description of what an attachment injury is. And what happens if we experience an attachment injury from a very, very young age, we'll then move into a state of shame, which tries to protect us because that modifies our behaviour so that we'll be attractive enough for the caregiver to want to reattach to us. So therefore, we're safer. So shame, from my perspective, is always about protection. And there's various different elements of shame as well, which probably isn't for this podcast because it's probably too much to talk through. But shame's a really, really uncomfortable feeling. So we have to do something with that uncomfortable feeling. What we're going to do with that really uncomfortable feeling is that we're going to self-soothe. And as you know, Kath, one of the ways that children self-soothe is through touching themselves.
Yep.
And it feels good and it takes them away from the pain that they're feeling, from that attachment injury. And then what happens is, so they've already got this mechanism, and then what happens is that they discover masturbation in its more adult sense when they become older and they discover porn and it's like, oh my God, this is just fantastic.
Well, that's the link. So I do want to say, for anybody that was like, they touch themselves, actually that can mean their hair. It can mean, I don't know, their neck, their shoulders, their knees, toes, and everywhere in between. But actually there is a particular, and I'm just thinking, let's go medical for 1 second. There is a particular set of neurons that exist in our genitals and other areas that probably feels, now nobody's ever been able to sit down with a child and ask these questions for ethical reasons, but it probably feels much nicer than twirling your hair in terms of what children do. Now, children do tell me that they like it when certain things happen in their bodies. And for a lot of young children, certainly in the under fives, it's usually to touch wherever they can. But what we tend to do, and this is one of those things of shame, Lisa, right, where I've worked with parents who have smacked their children for putting their hands in their underwear. And if we think about what that then conveys, self-soothing is okay if it's your hair, self-soothing is okay if it's your ears or picking your nose or whatever it is, but not there.
Yes, and
so
of course we know now that the clitoris is packed with nerve endings, and the anus is packed with nerve endings. So when you have children that just rub themselves, boys can rub themselves on the floor because it feels nice with their anus, and girls can rub themselves on the floor because it feels nice with their vulva. And that's part of the self-soothing, isn't it? It's not a sexual act, it's just a way that people do things because it feels nice.
And absolutely.
Just to give you a reflection on that, Silva, what children do now, I'm going to use a word that's probably not understood by many people, but there's a word called frottaging, which tends to mean somebody rubbing themselves up against something. Actually, that's what I see children doing, and they will quite often it might be up against the sofa in the therapy room, or it might be up against a teddy bear. So that there's something about just watching and going, okay, this is a self-soothing technique. And my work as a child therapist is not to shame the child in that moment, and to explore what is really going on here. So I'm certainly thinking that was something I wanted to just put in there, Lisa, that children touching themselves is usually conditioned into acceptable versus non-acceptable.
No, you're absolutely right.
But then Lisa, with your sorry, I wanted to ask you a question, Lisa, with your theory, when people soothe their shame with touching themselves, and then that is reprimanded, does that mean that then the shame kind of grows into more uncontainment?
Yes, it does. So no, you're absolutely right. So they are shamed for that self-soothing mechanism, which then feeds into everything that we were saying there before about sex just become shameful. Everything that they're doing around sex is shameful. And what I've also noticed, and I'm sure it's the same for you as well, Silva, when you ask adult clients about those first experiences of touching themselves, often they can remember it, but they never say it is a sexual act because it's not a sexual act. That's something that sort of develops later on. But that's exactly what happens. So you've just said there about uncontained shame. So what we mean by uncontained shame is that acute experience of shame that comes as a shock, you know, when we get told off. So it's like what you were saying, Catherine, that the parents will just dive the
Well, your
child
fingers will
for,
go green. I've
well,
heard that.
yes,
Your fingers
all
will
sorts
go
of things are
green.
going to
It'll
happen.
drop off. All the terrified. The thing about your body could actually explode, and you
Yeah.
could. It's horrifying when you think about what is being conveyed. Like,
Yeah. So they're getting told off for something that they don't even understand is anything wrong, because they don't feel like they're doing anything wrong. They're feeling like they're doing something that a child needs to do in that moment, which is to soothe. But then that shame just carries on into adulthood and
mm,
can carry on for years and years. You know, if we see older clients, you were talking about 18s, aren't we? But if we see older clients maybe in their 50s and 60s, they still feel that same amount of shame about their authentic sexuality, about the things that they're interested in, about, you know, what it is that they are doing. And it actually comes from way, way back, which is why, as Silver and I would both do, we look at things from as far back as we can possibly go. So we actually spend quite a lot of time in childhood, because that's where often these blueprints for who they feel like they are
yeah.
come from.
Well, I mean, for me, that's a no shit Sherlock moment in terms of and certainly one of the things I help the parents with is, okay, when that's happening, and I'm thinking it might be important for parents here, is you can say to your child, hey, I don't know if sweetie's the right kind of word here, you know, in terms of whether it's overindulgent or a bit strange for some people, but hey, I know that you like to touch yourself there, but we don't do that in public. It's a case of it's okay to do that, but maybe not in the living room when grandma is sitting over there with her cup of Earl Grey. You know, maybe not here.
No, it reminds me at the very beginning of my career as a therapist, I was a youth counselor before I became a sex therapist. So I was working with people from the age of 11 all the way up to 25. And as part of my role, I was also I was leading a queer youth group for people in the adolescents. And because I was the queer therapist, I was basically also the therapist where I was referred to young people who wanted to talk about sex, but, you know, like hush, hush, he's the therapist at the end of the corridor. You go to this one.
Yeah.
And I remember once, and it happened many, many times, but a particular time where a child, I mean, he was below 18, he was 15, 16, and he came in panic. He was crying, he was shaking, his entire body was shaking because he was told that masturbating would mean that he would die of a liver disease and that he will become blind and that his internal organs will just liquidify. And he had just masturbated and just ejaculated for the first time. And so that's why he just came into panic.
Oh,
Because he believed he was going to die imminently. And this was so awful, really, to see such a young person in such distress for doing something that is just so natural. And when I think of that, when I remember this story, I just can't help thinking that parents can be really cruel to tell their children these kind of things. You know, there's some real cruelty about the sex negativity and the things that some parents resort to in trying to stop their children from feeling and exploring their sexual development as they should.
so I've just thought there's another podcast here in terms of what is it about the framing of parental disgust about children being sexual and touching themselves. And I do want to make a point, and I'm well aware it's probably not to do with this podcast, but I do want to make a point about some of the language we use for children means that we adultify it. So if I give you an example, one of the reports that came out about children recently, in terms of the ones that were being coerced, talked about 3 to 6-year-old children masturbating, but actually they're not masturbating in the same way that an adult would. So when we use an adult word to describe what a child is doing, the very fact that it has the adultification kind of gives that essence of, oh, that's because they are enjoying it to the outcome of
yes,
as you were talking there,
but that's precisely why the sexual conversations are so hard to have with young people, is because the adults are sexualizing it. They think that if we're going to be talking to young children about a boy holding hand with another boy, they automatically think we're going to talk about gay sex, you know, but this is not it. You know, we are the ones sexualizing the conversation with children.
Well,
but we just need to normalize, like you say, we need to normalize that we have a sexual development as children, and we need to be able to talk about this. Otherwise, we're really doing a disservice to the young people.
So can we talk then, or should I say, can you two talk? Because I'm jumping in all over the place here about, and I'm thinking there are some rogue sexual educators, Silver. So, you know, that idea of they're going to talk about gay sex. Oh, that happens and you don't want to know how. But can we talk about how we address this, right? So how do we debunk these myths of children exploring themselves, their sexuality, moving into adulthood? How can we debunk these myths that exist on social media in terms of those spaces that you were just kind of addressing there?
I think we should just normalize it as much as possible, really. And sometimes, because there's so much myth out there in sex and relationship, there's so many myths and so much misinformation that it just sometimes we just have to put the right, correct information that is evidence-based out there in a way that is not sensational, in a way that it's just easy and normal. Just like we socialize children to talk about their favorite food, and we are still, you know, normalize it with children to talk about their favorite hobby, their favorite sport. We need to also normalize talking about sexual development, because it happens.
Now,
In this kind of like matter of fact way, you know, this is
yeah,
your nose, this is your ears, and this is your vulva, you know,
yep.
that
And
kind of language.
I've done that in so many trainings, and people are like, sorry, did you just go knee, knee, elbow, vulva? What? Yes, I did, because actually anatomical and correct medical language. Now, the thing that I did find in the sex education when I was teaching it is, so you teach children the right medical names in case they need to A, go to a GP, or B, go and report a rape. And I'm like, what? How does that even come to? I'm sorry, but what is it that we're going to be talking here? So certainly when I worked with the young people and they were putting the swear words on, one of the things I used to say to them is do you think this language is appropriate? And of course, all of them would go, no. And I said, let me tell you, you are not going to use medical language in the bedroom. So these words, you have to work out with your partner what's acceptable, what they take offense to, what they want to call things, and you have to have that discussion beforehand. And it's so interesting that some of the young people are like, oh no, I couldn't do that. And I go, but you could get naked and have sex with them. Well, yeah, but the talking about it doesn't happen. So how do we do that, Silva, when there's, and Lisa, in terms of how do we do that when there's the bullshit on the internet? And also, we're probably going to get some haters on this podcast in terms of you're talking about children and sex and blah, blah, blah. You know, anyway,
Look, I'm
bring the comments on.
because I put myself as a specialist in gender, sex, and relationship diversity therapist. People think I'm a groomer. I mean, I've been called a groomer on social media, right?
Okay, I'll put that in the hashtags
those
then.
are my trolls. I know, but that really goes to show how really far those myths go and how really emotive those conversations are, because people are so afraid of those conversations, really. But I really think what we know in research across the board is that what works best is good, inclusive sex education that is age appropriate. And we can have that from primary school, when we obviously don't talk about sex, but we talk about sexual development, we talk about bodies, we talk about accepting differences. And this is so important for all human beings to be able to have conversations with. And as the young people ages, we talk with more and more kind of like age appropriate information that they need at the time. And that really, really helps. And we know that that does help. And yet we don't do it. We absolutely do not do it. And when there was, even in the UK, when there was a real push to do inclusive sex education that includes LGBTQ educations, we had so many religious folks that came out there and said, we will not have that in our schools. We will pull our children out of the schools because we do not want LGBTQ education, because they sexualized those terms. They think that LGBTQ means nasty sex. And that's not actually what it's about. It's about knowing that there are people who are different.
Yeah, well, I mean, that's just brought up all of the pushing around. Well, what is this safeguarding? Is this actually one of the things about safeguarding is children not having choice, and certainly that idea of not having all of the information. So I do know the PHSE Association is trying to push for inclusive sexual development type language, age appropriate. And again, age appropriate is one of those nebulous terms, because it's kind of, well, what does that mean if you've got age appropriate conversations happening with 9-year-olds and one of those children has already been exposed to sexual abuse? Or we live in a space where we have to have these conversations. So
Yes, but you have them. You're having them because one of the things I really love about it's another plug for you, Kat. But one thing that I really love about what you do, what you put out there, is that you some of your videos are so simple and yet they make so much sense, but they are normalizing things. And about that conversation, about the fear of it all. One video that I love about one of your videos that I love is to say about the woods, the woods and the bears, when children are involved in social media, children are involved out there with other people, with peers, and we have to be able to educate them, not to say, we have to ban the woods, you must never go to the woods, but to say, if you're in the woods, be careful, because there are some really wonderful stuff in there, and there are the bears, and there are the dangers, and in order to navigate the woods, you've got to know what they are. And
well, that's okay.
that is the perfect
That's
kind of
okay,
education
because
that we need.
well, I'm just thinking, well, bears are preferred to men apparently at the moment, aren't they, in terms of
Well, they are,
watching any
yes,
good, yeah.
indeed. I did actually vote for the bear.
That's true. Yes.
So, I mean, oh, yeah, we've, mind you, we've been doing this for a long time about disabilities, haven't we? It's like, don't look, don't talk about it. And certainly the approach I took with my children, and I help the parents understand. Sadly, the work I do is always after there's been sexual abuse. Unfortunately, that is my work. So it's after something has happened, and then we have conversations about, so what were you talking to your child about? How did you have these conversations? And more often than not, it's that I didn't know what to say. So
Right.
if we're thinking about normalizing this, and I'm going to come to Lisa on this, what is your research, or what is your thinking bringing up for you in terms of how we have these conversations that doesn't bring shame into it? Because the morals, the morals, the myths, the values, the religions, the different countries, the different what can we do? That was a really big question. I'm aware of that.
It is a really big question, and it's a really tricky question as well, isn't it? Because you're right, we have to bear in mind other people's cultures, what their beliefs are, and be as respectful as we possibly can, because it's not for us to say how things necessarily should be done. And I think everyone is trying to do the best job that they can to protect children. And yeah, that they might get some criticism from this podcast, but ultimately what we're trying to do is keep children as absolutely as safe as possible.
Mm-hmm.
And I really feel for adults and teachers who are supposed to be giving children this information, because if they'll have been shamed themselves as children, and it's just that cycle that then repeats. And I know from working with parents, they're not here because they're parents, but working with adults in the therapy room who are parents, and knowing how much shame they have about their own sexuality and what they're up to, or what's working and what's not working. Often it's often about what's not working. So they have so much sexual shame. To then be able to have that conversation with their children is really, really difficult for them.
Yeah.
Or I've had teachers, who are responsible for sex education, and they're having real difficulties in their sex life, and it's so difficult for them to then have this conversation pretending that they've got it all going on when actually they haven't. So I think it's a really, really tricky thing to navigate. And when you asked the question a couple of times, what do we do about social media, and I think Silva gave a really positive answer. I don't feel very positive at all, which is why I kind of held back a bit, because I think there's a term called lay epistemology, which basically means that lay people have knowledge, and they get their knowledge from certain things, and where they're getting their knowledge from is from social media. They're not necessarily looking to the scientists to gain their knowledge. And right now, lay people, for want of a better description, have much more of a bigger voice than the scientists do.
Or the Dunning-Kruger effect of the people who think they know and understand this landscape because of something that they might have come to this in terms of, I don't know, working with one client or a couple of clients, or I'm just thinking about there's a lot of myth out there, isn't there? So
Yeah, I mean, I'm thinking more about so it's to go back to that term lay epistemology. What I'm thinking about more is the guys who set them up as sex recovery coaches, who are there because they feel like they've had a problem with porn or something along those lines. They go down the NoFap route, and then they've got massive followings on Instagram, and that's where my clients are actually looking first for their information before they come to see me. So
Okay,
they come in
let's
to
go
see
there.
me with all of they come in with all of this information that they think is really, really good information that, they should have a certain amount of days underneath the belt of NoFap. So for people who don't know what NoFap means, it basically means no wanking. So yeah, they come in with all of this information and I have to say, well, where you're getting your information from isn't really that scientifically robust. And we have to start it right there with what they're actually bringing first, and because they'll always do a whole lot of research before they get anywhere near us, because the internet is safer than coming to speak to a sex therapist face to face and be really vulnerable with somebody.
And for information, it's really important to also say, since you've mentioned NoFap, that it has now been documented multiple times that NoFap is part of a manosphere. It has very, very inaccurate information, and actually it can cause harm because it increases suicidality in people.
Absolutely. That was so some people might know it as Reboot, but also this is wasn't there a film that was about 30 days of where he didn't actually masturbate? I'm trying to remember. Yeah, there was a film. It was Josh Hartnett in it, and he had 30 days where he followed the no fap movement. Not
Was it a documentary or a film?
Oh no. It was a film. I'll have to put the name of that in the show notes.
Oh, that would be
I'm having a brain fart on that one. But there is this thing about, I mean, this is what I was writing about in terms of the DDR2 pathway, in terms of what we call an epigenetics. Oh my God, it's a dopamine product that means that what's going to happen is you're then, and I can see you laughing, Silver, because this is that lack of, first of all, let me backtrack. Let's go #science. Let's go. You talked about this earlier, Silver. You said evidence-based. So what you're finding then, Lisa, is pretty much what I see on social media, which is people will follow influencers that are giving them information that's medically incorrect, in terms of, if you retain your semen for this amount of days, then this means that this is going to happen, and then suddenly your body will feel blah, blah, blah. It's a little bit like the vegan...
You're going to be a real man.
Carnivore. Oh, exactly. Yeah. I'm just going to hand it back to you. So this is, how do we... Okay.
Yeah. Yeah, and it's so shame-inducing, which is obviously when the suicidal ideation comes along, isn't it? Because inevitably they fail at doing the streaks of how many days they're going to not have a wank for, and then feel absolutely terrible for it, and feel like that they haven't been able to achieve something and be part of the group that they want to be part of, and it's a real mess, to be honest.
Yeah.
So what I'm finding is exactly what you just said there. It's much easier to blame porn for the problem, and I think this is one of the issues that we have generally. If we can blame porn for the problem, then we don't have to actually look anywhere else.
Well, we can get rid of it, and there you are. It's the fact that magazines exist, VHSs still exist as far as I'm aware, CDs and DVDs, and all the mechanisms. And I did see this, and I meant to pick up on it and have a chat with you at some point, that somebody was in a tweet somewhere blaming porn, and actually Elon Musk came back and said, actually, the highest rise in porn was when the VHS tapes came out.
Yes.
So we're not, yes, it is ubiquitous on the internet. And yes, there's this, and I sometimes talk about the amount of pornography that's on the internet, but actually pornography spans different types. We're going to get into this myth of porn now. There's different types, there's different genres, there's different spaces, there's different people who are creating the material. There's the one that generally gets blamed is the curated stuff, isn't it? It's the professional actor who does blah, blah, blah. And actually, I would say with most of the young people I've spoken to in the last decade, they tend to watch amateur, not the curated stuff, because they know the curated stuff is actors. So,
yes, exactly. And I think that's a very, very good point that we tend to dismiss, is that young people know what porn is and what porn isn't. And I think that's
Yeah.
really, really important. And sometimes they know that they watch it for entertainment, and sometimes they know they might want to watch it for sex education, but they know what they're watching it for.
Yeah, I agree.
I would put, I'm wondering at what age that starts to become, this is me going off on a slight tangent now. I wonder what age that starts to come in. So I'm thinking about 9-year-olds will do the, and I'm going to have to do this for people that are listening, where they go, and they mouth it out, you know, they spell it out for me. It's this thing that don't tell my mom, don't tell my mom, but so-and-so on TikTok said it. And then, of course, the thing that we don't often talk about is the not porn, which are the people who are on TikTok giving out sexual advice that have no qualifications, that are often, and I'm going to be very graphic now, you know, showing you how to do a blowjob by using a banana because that's how they would do it, etc., etc. So when we are pointing fingers and blaming porn, and we get rid of all this sexual material on the internet, what are we left with?
We're going to be left with young people still being curious about sex, still wanting to have some sexual pleasure with video content, and then they're going to go to places that are more dangerous.
Yes, well, this is why I'm so opposed to the smartphone ban, but we're not going there in terms of the smartphone ban, the social media ban, because actually that is exactly what will happen, and it is happening and has happened with a lot of this sexual material that children find themselves on a bit of a voyage, if you like, in terms of what it is that they're looking for, which I will make a statement
but also
now.
I just want to say, oh, carry on, sorry.
It is not the pathway to offending. It is not the path. There's lots and lots of different ways in which people follow that route. But certainly, going back to that point you made, Silva, yes, a lot of the young people do know the discernment between that is actors. And even if I'm watching amateur, I know that that's two people in their bedroom or wherever doing what they're doing, and that actually they do have an element of sex education. They do have an element of that's what I'm supposed to do. That much is true. But it doesn't necessarily mean that they're going to become addicted or continue to watch it, because sometimes it's like, yeah, I've watched that. It didn't really do much for me, or I'm curious. And I'm thinking I've worked with clients who wanted to know, and this is that kind of sexual abuse route, that they were told if they watched two gays having sex and they got a hard on, that meant they were definitely gay, which is not true. And that was the conversation that took place over many different sessions. But this is what we're talking about. Sorry, Silva,
Yes.
do carry
Yeah,
on.
no, sorry, I interrupted you. Sorry. No, you're right. I mean, people watch porn as well for exploration because they want to know different things, and there are some things that they're gonna watch that not going to produce any kind of titillation of pleasure, and they're gonna click away and watch something else that they prefer. So this is really, you know, often people do follow their own interest, and it's not like porn is going to rewire their brain into some things that are, you know, illegal or become a monsters or a sex crazed person. That's that's part of the fear mongering story that just really isn't true at all. But also, I think about porn, the other conversation that is really, really missing is how meaningful and amazing and helpful it can be for the sexual development of people, because that is the positive part that we don't talk about. And we know in research also, and especially with people who are marginalized. So we're talking about people of color, and we're talking about queer people, that watching porn that is about their bodies and their sexual behaviors is actually affirming to them, because we don't see that in the mainstream porn. It's not that you know, queer sex is not affirmed out there. You know, we see heterosexual sex everywhere with commercials. Chocolate commercials is very sexualized commercial, and it's usually, you know, a woman giving the blowjob to the chocolate bar and these kind of things. And so we see that everywhere, but queer sex is not. And so people go to have watch gay sex to affirm the sexuality, and that is very meaningful, and that is very, very good and very healthy. To the point, in fact, that there's a study that shows that if we use the porn addiction narrative to queer people, it can be harmful because it could be a form of conversion practice.
Yeah. Yeah, love that. You brought in the science. Yes. I mean, can we just throw loads of studies at this? And I do want to say actually that when I'm in the spaces where we're talking about sexual abuse and offenders, what actually seems to be the biggest factor that is in every single case is child trauma. So I just want to make that, it's not pornography, it's child trauma.
Of course.
And
And there
The
was
child-
sexual abuse as way before internet and way before porn, right? So
Yeah.
Yeah, and this is my concern. Sorry, Cass, just to say, my concern about blaming everything on porn. If we're just going to look at that as the thing that's actually going to cause all of these ills, then we're missing absolutely everything else. And as Sylva's just said, all of this stuff was going on well before porn was accessible in the way that it is now.
So if I did a very quick kind of, it's not a formula, so please don't take this seriously, anybody who's listening, in terms of we've got child trauma and then the development of intimacy. We're going back to what you said, Lisa, in terms of those attachment injuries, the kinds of interpersonal difficulties. And when I say child trauma, I'm not thinking that an earthquake would then create a child who then developed into it. I'm talking about interpersonal violence, conflict, attachment injuries, real deep intimacy issues. And what that then possibly syncs up with is what I talked about in the kind of TED Talk. If you don't get your needs met, you're going to try and find something that meets that need. And if we're talking about shame and we're talking about all the other things, I'm sure that not one therapist listening to this would go, oh yeah, I can see why somebody would do what they're doing. And of course, it's because they looked at pornography when they were under 12 or whatever, and that's what led to this. Because actually the therapist doing the exploration would find the shame and all of the things that we've talked about.
Yeah, that absolutely would, which is why, doing that real deep assessment of history takes is just so important to actually understand, it's a very holistic approach, isn't it, to understanding what's going on for someone. But you're right, it's not necessarily just about the self-soothing, it's what porn then becomes for someone is the opportunity to have needs met. So the thing with shame is that we're desperate to be seen and desperate not to be seen at the same time.
Yeah.
So porn then becomes the solution. It's not the problem, it's the solution to lots of people's difficulties when it comes to relationships, because they can access whatever it is that they want. I'm talking about legal stuff here. That's a whole different conversation. In a really, really safe way that's not necessarily going to trigger their shame at that particular point in time. Now, the difficulty is with people, what I say all the time, and I'm sure that Sylva says this constantly, and it's what's coming up in my research, is the shame that's felt afterwards.
After, yeah.
Because they've done something that wasn't okay.
Yeah, but that's the same as the person who drinks alcohol, isn't it? And I don't want to use the word alcoholic here, but that's what happens. And we have this word, and again, it ties into that relapse, no fap type of space, doesn't it? This is the after shame. So a little bit like, and don't we work with that in terms of compassion fatigue and afterburn? There's this space between feeling like as a therapist you're taking on too much, only to find out that you've burnt out and now you're in afterburn. And then what you do is the reflection on, I took on too much, I didn't go to supervision enough, I didn't da. So even in our profession, I suppose we do the same process, but then we don't kind of think about the way in which our clients are doing the same, maybe.
Yeah, absolutely. And I think this is back to the point that we were talking about before about how it's much easier to make porn the problem. So it's quite common to see clients who come to therapy saying that they have a porn addiction, porn is the problem, and if they could solve that, then everything else is going to be okay. Everything in their life is going to be absolutely fine. Because what they're doing is they're basically just contracting the shame that they feel themselves into this particular external thing. So porn is it's just this thing, isn't it? This nebulous thing that people are aware of or that they do, and it's very externalized to them, and it's a much safer thing to do is to put it into their porn use or their porn viewing or whatever it is that you want to call it, rather than actually being able to sit with, yeah, I'm not feeling okay, I'm just not feeling okay.
Which, when it comes to, and this isn't a plug for my next book, but totally in my next book, I'm talking about why we use social media in the first place. And it's all around those needs and drives and wants and desires. But we're really talking about shame and intimacy here, aren't we? They're the two things that go hand in hand. So the sex side of things is, and I'm going to use an addiction term here that I've seen written all over the place, but I think it's a really nice way of describing it. It's a first, what's the phrase that I'm looking for? It's she says having a brain fart, just as I was about to say it. It's, in psychoanalytical terms, we would talk about defensive accommodation, and it's a first order reward. in terms of it's biological, so it's not the same as a second order reward, which is, I don't know, going and doing exercise or drinking alcohol or etc., etc. So in terms of earlier on, and I'm just looking at the time, in terms of earlier on, you talked about compulsive sexual behavior because that's the term that we use. So what would you say is going on here in terms of the myths, that phraseology, Silver, and what's the connection between compulsive sexual behavior, pornography viewing, and what we might be talking about here with shame and intimacy? And that wasn't a PhD Viva, by the way. That was just asking you to do it. Sorry.
No,
I think she directed that question to you.
I think what Lisa said earlier, I think it's really important to repeat, is that the ICD, we only have one diagnostic criteria at the moment for compulsive sexual behavior, and that's through the ICD-11 diagnostic criteria, and that is by no means a perfect one. But that's the only one that we have. So, and that only came out in 2018. Before that, it was all anecdotal, and people used the word sex addiction all over the place. The thing is that because of the research that could never find evidence of addiction, now it's become compulsive sexual behavior, and it's been agreed as a diagnostic framework for a disorder.
Yeah.
But that is very, very contested because there is quite a few problems in that in those criteria disorders. In some ways, I'm glad there's something, because it means that we can guide research away from the addiction research that's been very, very unhelpful for the last 25 years, and do a different kind of research. So in some ways, it's helpful to have this ICD-11 diagnostic, but also it's unhelpful for clients, and I think it's unhelpful for therapists. It's unhelpful for therapists because often they misuse the diagnosis, and so they over pathologize people with a disorder. And also it's not perfect because they're putting two different categories in the disorder. They put the impulse control category, but they also say it's a compulsion, and those two things are very, very different, and so it's really confusing people.
And also shame driven, isn't it? I mean, if we talk about a victim, because there's something in air quotes wrong with you because you have a compulsion that you cannot control.
Right, exactly. It's got to be out of control. And of course, we know that most people do what they do, even if it's outside of their relationship agreements or whatever. People do what they do because it brings pleasure and because they make a meaningful connection with a part of themselves. And it is also for soothing and self-regulating, what we have been talking about all this time. So we do need to look at that. And one of my biggest thing about this, actually, away from the nomenclature, is that it's how therapists are delivering treatment. And that's always been my biggest thing, because what I hear over and over again is clients not getting the right treatment for their sexual behavior problems. And the issue here is that if therapists are going to go with one framework, one modality, or one program, say, usually it will be like the addiction program or the addiction, quit porn or quit this or quit that, which is still very, very prevalent. It means that they're doing one method that fits all. And even if they say, oh, I adapt my treatment to everyone, if the framework in their mind is a disorder one and a deficit one, they will be working with that with clients, which means that if then the client doesn't get on with the program or doesn't get on with that therapy, the therapist blames the client for not doing therapy right, rather than thinking, or maybe I'm not choosing the right treatments.
Yeah, because it's not even an eye-down relationship, then, is it? It's a superiority model.
Yes, I know your problem, and I have the treatment.
Yes.
I have the treatment for your disorder. And going back to what Lisa was saying earlier, when the client thinks, first of all, coming full of shame because they're doing some sexual behaviors that they don't understand, and they're completely in the dark with their erotic processes. They are full of shame, and the therapist says, yes, this is your disorder, and I can just I've got the treatment for it, and then the treatment doesn't work. The client is even more full of shame. And then the therapist says, you're the one not doing the work properly because they're not self-reflecting, because they don't have enough tools in their therapy box. So they blame the clients, and then the clients at the end have extra layers of shame. And by the time they find the courage to leave that therapist to go to somebody else, then we have to work first with the harm of the last therapy, because then the client is completely wrapped in acute shame all over the place. So
Oh,
that's a very big issue for me, because many
yeah.
many clients have that experience. And since writing my book in 2021, I get every week, almost every week, emails from people all over the world that says, I've read your book, I've read your articles, and thank you for giving me a voice, because that's exactly what happened to me. I got harmed by 12-step programs, sex addiction programs, and I got harmed by my
Yeah.
sex addiction therapist. So it is actually not just one or two isolated cases we're talking about here. We're talking about a huge cohort of people who go for help, for therapy, and then they become worse after the sex addiction therapy.
And this brings me to the thing that popped up in my head, which I'm going to come to Lisa for, because I know this is something she's spoken about. This is because people are either told or believe that they have something called a sex drive. So Lisa,
Not my favourite.
yes. So there's that.
Yes.
Well, I mean, it's your sex drive is clearly either not enough or too much, or oh, okay, Lisa, take the floor.
Yeah, well, absolutely. Thank you for that, Kath. And I think that's exactly, isn't it? Yeah, yeah, either too much or you're not enough. It doesn't really matter whether you put sex drive in the front of that. It's just this idea that you're too much or not enough. And I just find it so problematic, because actually what we really know and what the evidence suggests for us and research is we have motivation or incentive to either move towards or to move away from sex. And we have multiple motivations for moving towards sex, which might be, or if we just put this in the context of porn, that it's the only way that you are going to get any sexual satisfaction, because you can't get it anywhere else, because it's safe and it's private. No one's going to actually know what it is that you're doing. If you can't describe to a partner what it is that you really like, which might be a kink, for example, you're going to find it there. That doesn't necessarily mean that you've got a high sex drive, or even that you've got a sex addiction. What it means is that this is the safe space that you can actually get those needs met.
Yeah. Which is attachment. When you're thinking about, and we go back to that word intimacy, when you think about what it is that people are looking for, it's almost like the scenario where a couple will fight so that they can have makeup sex, because that's the only way that they can feel soothed, even though what they really needed right at the very outset, and I think I've called this pots and pans arguments, in terms of when people are arguing over who's washed the pots and pans, it's not about the pots and pans. It's actually about something else. But that happens to be the moment in which we're arguing, because then you can have the passion, you can have the intimacy. And there's also what you were talking about is exactly what used to be called, I don't know if it's going to continue on with its nomenclature at the moment, is that disorganized attachment. I want to come towards you, at the same time I also want to move away. And sexual intimacy seems to be a version, an erotic version of attachment.
Absolutely, I couldn't agree more. And obviously, we're heading more into conversations about adults here, and I'm sure Silva would have something to say about this, about people that we see who their partners have told them that they're a sex or a porn addict, and send them in for therapy. But the reality is they're so terrified. So it's what I would call shame anxiety. They have so much shame anxiety about actually having partnered sex, because they might have erectile difficulties or something along those lines,
Which
that
is
they'll
down to
avoid.
porn. Don't forget, that's down to porn.
Oh, that's it. Yeah, we definitely need to put that one in. So what happens is they'll avoid their partner because they're so terrified of the shame that they're going to feel when their erections disappear, or they don't get an erection at all. But they can get an erection when they're watching porn. And the reason why they can get an erection when they're watching porn is because they're safe. They're regulated.
Exactly.
Yeah, go on, Silva.
Yes. No, you're
Chime
right.
in.
Yeah, absolutely. And there's even some research that says that erection quality in solo sex is better than partnered sex, even when there's no dysfunction. Because when you have partnered sex, you have to worry about your partner, you have to worry about being a good lover, you have to worry about your partner's need. When you're doing solo sex, you only have to worry about yourself and nobody else. And so, of course, you're gonna have better quality erections. And that's without a disorder, without a dysfunction.
Okay, I'm just going to come in with something here, right, which I love talking about in the training when I'm doing this. And how was that research conducted, do we think? Because, the very fact that you have to be in front of people who are, in air quotes, testing your erection level between, do you know what I mean? It's like when we look at sexology research or sex-based research, you're looking at abnormal situations in most of the cases, aren't you, in terms of where this
Yes,
is?
and a lot of it is self-reported as well. So,
Oh yeah,
you
it was
know.
absolutely, it was like a rock on that day. But again, have you noticed that even as we're talking here, there's a little bit about, we are talking about sexual, let's call it performance or sexual degrees of I don't know. What do I want to say here? I'm just thinking athletic prowess, right?
Yeah.
But actually we are talking about erections, which means we are talking about the male body or that particular appendage. And I'm aware
Well,
that I will get
sex addiction doesn't happen to women, don't you know? Because a woman who has vibrant sex life would be just so very, very wrong. You know, the women are love addicts, you know, it's about romance. It's not about sex, of course.
Yes.
You know?
Which I'm sure that, again, in terms of just the haters gonna hate, I made a gendered reference there to penises. There is also this thing about we're so lacking a whole heap of research in this space, aren't we? And I know certainly one of the colleagues that on social media, in terms of what she's putting out at the moment, Nicole Prouse, there's a lot about there's no funding for this because it's another one of those uncomfortable conversations. Yep. But I do just want to flick back to the pornography thing, because one of the things that cropped up, and I'm seeing this on social media at the moment, is and it is the narrative of the man chooses pornography over the woman, and it's for those reasons that you've just said, Silva, isn't it? Yeah. In terms of and Lisa, for everything that you're talking about, there is this thing about, well, maybe it's safer. Maybe there's something about that. There's more confidence. There's more. Again, there's a lot going on there, isn't there?
That's right. And sometimes, you know, people watch porn also for fantasies and just to feel good about their sex life and their sexuality when they have problems in their sex life in their relationship. But also there is a fascinating research on sexual fantasies by Justin Lemiller, who says that even though people watch porn, they tend to not think too much about the porn actress or the porn actress, like the favorite porn performers, because they tend to still watch it and imagine they were having sex with their partner, and their partner is still the kind of the main person that they have in mind, not the actual favorite porn star. And I think that a lot of people don't know that, and that's why a lot of partners feel very anxious about their spouse, husband, boyfriends, whatever, girlfriends watching porn, because they think it means that they are fancying somebody else rather than them. And some people perceive it as cheating and so on.
Yeah. Well, it's that social comparison, isn't it? Is I look at the person you're looking at and I see somebody that I am not.
Yes, exactly.
Therefore,
and yes, and when we, you know, you were saying earlier, Kat, there's different types of porn, but also people use porn or watch porn for different reasons. And a lot of the time, if you ask people what they focus on when they watch porn, they will not always say the genitals or the penetration. Sometimes they say, I watch the porn actor's face because I want to see pleasure.
Now, there is a good piece of research, and I'll have to find the name of it, but I did see a piece of research that looked at the gender differences using an so I'm fascinated by how eyes work. And apparently when this research was carried out, the men would look at the genitalia and the women were basically taking in all the surroundings. So they were probably like looking at going, that's a nice bed. I like that wardrobe.
I don't know. I have a lot of cisgender male clients who say they want to see the actors having fun and having pleasure, and so they're looking at the faces.
So, I mean, I know we were going to keep this to about an hour, and we were sort of in that region. So, when you were talking a minute ago, one of the things that's cropped up is what I was talking about in that training that I was doing recently, mirror neurons. When anybody, so this might be a child as well, when somebody is watching something on a screen, mirror neurons, highly contested, by the way, in terms of neuroscience, because the jury is out on this. However, there is an element of understanding the feeling and knowing of what you're watching because you have felt something similar yourself. Therefore, if you see somebody stub their toe or something like that, I'm just trying not to traumatize people here, that you will also go, oh, I know what that
I'm just feeling my toe
like.
just now.
I'll give you some therapy afterwards, Silva. We'll have a that was cyber trauma for you there, wasn't it? In imagined toe stubbing. But we do this, don't we? We know what something looks like or feels like. And
Yeah.
actually, that, I think, is one of the underpinning motivations as well, because there's something about we are experiencing what we're watching if we're experiencing something that we've seen before and understand and know in our own bodies.
Exactly.
But to the question,
Yeah.
then that I was going to get to. The thing that I see, and this is a big myth, so either of you can jump in on this. What about that idea of porn does not show pleasure? It shows, and I'm thinking of the words here, misogyny, violence, and where is the pleasure in porn, and where do people actually see that? What is it that they're getting that they recognize as real pleasure?
Okay, well, I'm just going to go from my perspective, but Lisa might have a different perspective. If I, going around like Pornhub and so on, I see,
For
again,
research, for research.
for research, of course, I see, like you were saying, again, there's different types of porn. Not all porn is the same. And I do see, like the mainstream, if I go on Pornhub, the first images that you get or the first videos that you get straight off will be the heterosexual porn videos. And it's usually a young woman who looks in pain because she gags on the penis, and the male actor who looks really, really bored. And that's like the studio mainstream pornography that you get.
That's the
And
stuff
so,
that a researcher talks about that she calls gonzo porn, and we're not gonna name, but
right. So that is for me really quite unsexy. And
Mhm.
also it's it can definitely show sex that looks painful, but somehow it's like what's supposed to be happening. So I do understand that young people with no sex education look at that and think, oh, if my girlfriend doesn't have tears choking my penis, then that means I'm doing something wrong. Okay, that is problematic. But that's just only one type of porn. There are so many other types of porn, and if you go then to the queer side of porn and gay porn, usually what you see is actors really loving it, really being into it, and that is a lot sexier. And then you have the what you were saying earlier, the amateur porn, where people do that because they love it. They love amateur porn, straight or gay. They love the amateur porn. They love filming. They love showing themselves doing it. And usually, if you do look at their faces, everyone's into it, and that's what a lot of the time people look for. They look for that hot sex scene where people are actually enjoying themselves.
Enthused.
Enthused, exactly.
Maybe. Well,
Yes.
we're not going to go too long in terms of adding on more here, but that's that idea of everything has to be enthusiastic.
Yes, that's right. Exactly. And then you have the ethical porn, or what we call ethical porn, when they sometimes include the consent conversations, those
Yep.
conversations that happens before porn, like you were saying earlier. It's important to have those conversations and to have the enthusiastic consent. And usually with ethical porn, they also show different types of bodies, transgender bodies, people, with more weight on, people with hair, people without hair, and the whole spectrum, which is a lot more realistic.
Yeah, well, that brings me to, isn't it Cindy Gallop that does the make love not porn type ethical
Yeah.
approach and the educative porn? But if you go to the mainstream fearmongers, you will find that there's only gonzo porn. Gonzo porn is the reason why everybody's in such a mess. Let's blame it all on that, in terms of actually young people don't, as I've put it, they do online shopping. They go to they search
Yes,
around the website for what it is that they're looking for.
exactly.
So to you then, Lisa, and then we'll have to wrap up in terms of timing wise, but what would you say in terms of the pleasure side of things?
I
And I
would
can't
I would
remember
think
what
I would
my
just have
original
to
question was.
agree with what Silva was saying. And I think for the majority of the people who I work with, that's people generally, not all people, some people do, and I don't want to shame anybody for anything that they want to view that's legal, obviously, but they don't find that kind of that hardcore violent porn particularly arousing. It's quite difficult to find violence arousing in that sexual sense. That generally isn't really what people are looking for.
Mm-hmm.
What they're looking for is the thing that actually suits their taste. So, like Silva says, and I'm sure you know this yourself, Kath. In fact, you say it in your book. People will go shopping.
Yeah.
They'll go and find the thing that they actually want. So, they'll maybe see that'll be the first thing that they see when they go on to Pornhub. But the shop come out of it, and then they go into their particular genre of the thing that they actually do find arousing, that they do find pleasurable.
Yeah.
And I think people generally watch porn because it's pleasurable for them.
Exactly.
Yeah. There is something about there is something about it's a little bit like when children are going on these websites, which of course they're going to be stopped doing soon because that's just the way that we're going, because we're gonna resolve that problem. But they tend to look at like, as you've said, the first section in terms of the thumbnails and so on. And yes, they do look to go, what is that? Oh, that's a bit, oh, don't like. And there's a feeling of disgust that they've actually explained in terms of, oh, that's not what I was expecting. Then they find kind of the categories and genres, etc., etc. And that's when the exploratory curiosity, oh, I didn't know I like that. And that's what, and I'm trying to keep it very, although I have sworn Effie Jeffy all over the place here, so it doesn't really matter now in terms of uploading it to YouTube. There is this thing about what they then go looking for is the exploration about, that's the thing that I find exciting or pleasurable, or that I didn't know, in the words of children, I didn't know I was into that.
Yes, exactly. But people are into things not knowing, because our erotic mind is vast, and it's not we don't explore all of it all at once. And sometimes there are part of our erotic mind that's always been there but dormant, until we either see something through pornography, or a partner invites us to do something new, and we think, oh gosh, no, not into that, never again, or we think, oh my gosh, I actually like it, great, I'll do it again because it's pleasurable.
And do I want to compare this to eating broccoli? Yes, why not? Right. So there is this thing about and I don't know why, but I've got a thing about talking about broccoli in terms of sulforaphane, because there's far more research on sulforaphane than there is on children's mental health around digital media, which was just one of those things that I was doing a comparison on. So in terms of trying vegetables, what you dislike as a child, sometimes you will try again as an adult. Does that make sense? I'm trying to use a metaphor here.
Yes.
It makes perfect sense.
Yeah, because actually sexuality and sexual preference and sexual desire and all the erotic things that you talk about, I think that seems to change across the life course.
Yes,
We're
absolutely.
not static. I wonder
No.
if, and I'm sure I've seen this in Scott Barry Kaufman's work, there are multiple intelligences. Sex and sexual practice probably fits under a form of intelligence as well, doesn't it?
That's right.
I
Yes.
guess.
And sometimes, with the broccoli thing, I don't know, but it could be also cultural, because if you are actually believing as a child that broccoli is boring, then you might not like it. And then later on in life, you revisit it and you might like it because you realize broccoli is actually quite nice. Coming from, I grew up in France. And so in France, we actually grew up thinking that vegetables are really, really super sexy. And it's great to have lots and lots of colors in our plates. So, we eat them a lot all the time. And it's really, really completely normal. But in England, it's somehow the mentality about food is different. And so depending on the culture, we can actually also be socialized to like or not like something at the beginning, until we try it again with a mature mind, and then we end up deciding what we actually truly like or don't like.
See, you've just thrown my stereotype out the water there, Silver. I thought you were going to talk about bread and cheese and wine.
There's that too. Of course, of course. I mean, don't get me wrong. When I have a stressful day, I go for the cheese because it's more pleasurable than the vegetable, Okay. Let's be honest here.
Right. Before we finish, or as we finish, can I ask you your opinions on, and I don't know if you've seen this, the recent Madonna event. So
No.
I don't know if you know this. Well, so this was on social media a couple of days ago. Yeah, a couple of days ago, I think, where she was on stage performing, and one of her dancers came up behind her and was masturbating over her vulva to an entire audience. And the uproar is children were in the audience.
Was it real masturbation?
I presume it was simulated.
Kind of. Well, it was very, very, very well simulated. Put it that way.
Oh, wow. Oh, okay.
I would personally see that as problematic, I think.
Yeah.
Because, yeah, like, no parent with a child is going to be expecting to see that. And if that was on the cards, I presume parents wouldn't necessarily
Very
want
probably.
their...
I mean, Yeah, there is a little bit of a it's Madonna. What did you expect? In terms of, as a 65-year-old woman, I think she does not care anymore.
Yes,
But
but
No, I mean, I've been good for Madonna.
Madonna's always pushed boundaries anyway, right?
Yeah.
From the beginning of her career, she's well known for that. But I think there's also sometimes artists tend to want to keep pushing boundaries, but sometimes they just get it wrong a little bit and they just step a little too far to what's appropriate.
so my reflection here then, since it sounds like both of you have not seen it, but my reflection would certainly be, and that is what I talk about when I say they're not porn. If we're going to keep blaming porn, we have to look right the way across the board, which also includes events and moments like that.
Yes, definitely.
Okay, before we finish, where can people find you? Is there anything you want to pop into the conversation before I press stop? And thank you so much for a wonderful conversation with plenty of laughs along the way. Let's see if this gets through YouTube's filters. Which I mean, if it doesn't, and this is being heard on audio only, that just goes to show the uncomfortableness with this conversation.
Definitely, of course.
Well, Sylva's mentioned vulva and clitoris, so I think we're buggered, really.
Well, I mean, there you are. Well,
I know we use medical terms. Oh my gosh, that's so wrong.
we did, but then I effie jeffed, so I think that'll be all right. But aside from that, where can people find you on socials? Where can people find your book, Silva, etc., etc.?
I'm on socials. I'm on X at SilvaNeves3, on Instagram, and that's SilvaNeves Psychotherapy. And my website is silvaneves.co.uk. So you can find me there as well.
Perfect.
You know what? I can't even remember what my usernames are on any of my social media things anymore. But I think if you just Google Lisa Epperson, you would find me. I tend to spend more time in LinkedIn than anywhere else. See?
Yep. And not forgetting, you've got a course on shame around this particular topic.
I do.
So that people...
Well, I have a course on shame. It's not necessarily specific to compulsive sexual behaviour. So the course that I have is about my theory that I've developed, shame containment theory, and you can find that at shametraining.com.
And that's certainly something I wanted to point people towards at the end here, because you're as useless as I am in terms of promoting yourselves. So I'm doing it for you.
Thank you.
Yes, and it's an excellent course, and not just for therapists. I think there's something about people could probably explore their own work.
Yeah, I mean, it's certainly it's designed for therapists, but certainly for social workers, teachers, and if you're in therapy, then maybe for your own personal development.
Yeah. Okay. Well, thank you very much to you both.
Thank you.
Thank you.